reconstructive surgeon. Again, Pure Plastic Surgery is our practice. Come check us out at pureplasticsurgery.com. You can book a consultation, you can see before and after pictures, and you are tuning into Thursday Thoughts. This is where we get to go over some common questions we get about plastic surgery and the procedures I do. If you have any burning questions for me, just submit it to the chat and we'll try and get to all of those as well, okay? We're going to be going over some questions related to breast lift today. So getting right into it. How long does it take to recover from a breast lift? So for the most part, people are going to be returning to all their normal activities of daily living within 1 to 2 weeks of having a breast lift, especially if you're getting a breast lift alone. This is a very well tolerated procedure. We can also lump breast reduction into that. The pain is actually quite minimal and people really tolerate that procedure really well. So about 1 to 2 weeks of some mild discomfort, maybe taking some narcotic pain medication for the first few days and then transitioning over to NSAIDs and Tylenol and being able to go back to work at a desk job in 1 to 2 weeks afterwards. And then we're avoiding the gym for about 6 to 8 weeks after surgery to let everything really heal up, but you can start doing light cardio, going for walks and stuff, 1 or 2 weeks after surgery. So will breast lift make my breast smaller? A little bit, especially depending on what we do, unless you combine them with an augmentation, which is something we do all the time, doing a combination of a breast augmentation with a lift to reposition the position of the nipple appropriately over the implant. But if we're not doing an augmentation at the same time, we are reducing the size of the breast a little bit because we're getting rid of some of that loose skin and also sometimes some of the redundant lower pole breast tissue. So we do typically make things a little bit smaller, but we can really limit that to doing a skin only lift if you're trying to retain as much volume as possible. So yeah, can breast lift be combined with breast implants? Yes, and this is something we do all the time. And there are certain things we want to think about when combining these two procedures. They're kind of two competing procedures. The augmentation is to really restore the upper pole volume and give you that upper pole cleavage. And the lift is to reposition the nipple appropriately over the implant so it's not hanging lower, causing what we call a waterform deformity or waterfall deformity. When we're doing those two procedures, we want to be kind of cautious about not doing one of them too aggressively. So we don't want to put in a huge implant while doing this because we're trying to reduce and lift with one and augment with the other. So how soon will I see the results of my breast lift? You're going to see it immediately. So right after surgery, you're going to see that everything is high and tight and lifted, but this is not your final result. You need to be really patient because everything's going to continue to settle, swelling's going to go away, some bruising is going to go away, but you're going to see improvement in the shape of your breast immediately, but you got to give it a little bit of time for everything to settle, especially if we're doing this in combination with implants. Those implants are going to be really high and tight at first. Things are going to be a little flat and blunted up here, and then everything's going to fall, get nice and round and soft. And that can take up to a few months, 2 or 3 months for it to really get to its final position. What are the risks of a breast lift? Really just like any procedure, we have, minor risk of bleeding, infection, wound healing issues. Those are, pretty uncommon, but things that can happen. One of the larger risks for a breast lift is if you smoke. If you smoke or you're using any type of a nicotine product, it can cause a dire consequence, which it can, because we're decreasing the blood supply to the nipple areolar complex when we're lifting it. If you're using a nicotine product before, during, or after the recovery of that procedure, it can lead to nipple necrosis. So that is the last thing we want to see. You got to be really cognizant of quitting smoking and not starting or being around anybody that's doing it during the recovery phase. Can a breast lift fix breast asymmetry? Absolutely. So it's very common for people to have minor asymmetries or even significant noticeable asymmetries, and a breast lift is a great way to address those issues. We're a little limited in what we can do with an augmentation alone. We can put in different size implants if one breast is a little smaller than the other, But breast lift is oftentimes one of the tools we need to really address the underlying issues with the asymmetry between the two breasts, because one is larger or one has more drooping than the other. Especially after breastfeeding, this is a common thing. People tend to favor one breast more than the other during breastfeeding, and that one tends to droop a little bit more after completing breastfeeding. So how long do the results of a breast lift last? This depends on a few different factors. One is just kind of your overall skin quality, and if you've had a lot of drooping before in the past. So patients that are massive weight loss patients, they often may need a second breast lift at some point down the road. Most other patients really don't ever require another breast lift, but that all kind of depends on your own skin quality and how you heal, and then also how you try to maintain those results by using a very supportive bra. Gravity does not stop for anybody, and the main thing we can do to help maintain the results of any breast procedure for a long time is wearing a nice supportive bra as much as possible. All right, that's the majority of the questions I had here. Do we have any questions from the audience right now?
What cc's should I go with to get a D cup? I am a small A cup right now. I was thinking 385 cc.
So this is an impossible question for me to answer without examining you and taking some measurements. Determining breast implant size is really based on the width of your native breast tissue, and that's not something you can really change. And then after that is choosing the right profile implant, and that's where you have more say in what we're choosing. But someone that's going from an A cup to a D cup, you're going to want to use a full profile implant. And oftentimes it'll be around that number you quoted, but it really depends on the other measurements we can do. All right. It looks like all we have for today. I appreciate you guys tuning in. Please come check us out at pureplasticsurgery.com. Let us know if you have any questions. You can fill out the form to start a consultation and look at some before and after pictures there. Have a great day. We will see you next week for another edition of Thursday Thoughts.